All right, hi. Let's try and address the elephant in the room, the neurological examination. So I think a good way to start would be to list them. Remember, for every examination, using our script-wise approach, wiper plus IPPA. Not all of the IPPA would apply in this case. So the first cranial nerve is the olfactory nerve. The second is the optic nerve. The third is the oculomotor nerve. Fourth is the trochlear nerve. Fifth is the trigeminal nerve. And sixth is the abducens nerve. Seventh is the facial nerve. Cranial nerve. Eighth is the vestibulocochlear nerve. Ninth is the glossopharyngeal. 10th is the vagus nerve. 11th is the accessory nerve. And 12th is the hypoglossal nerve. Now let's quickly address how you examine each of these. So the very first nerve, which is the olfactory nerve, cranial nerve 1, is assessed using the smell testing kit. Once you've done that, you have to use the smell testing kit on each of the nostrils bilaterally. Like I said, there are other videos that on YouTube that have really talked about the technique. Cranial nerve 2, the optic nerve, three things are assessed, what I call VVF. So you have visual acuity, visual field, and fundoscopy. Now, with that said, visual acuity is assessed using something called a specialist testing chart, which is based on the near vision of the patient. And if there's any abnormality, a formal, more detailed is using the Snellis chart is done. The next is the visual field. What is done is one uses the confrontation test, which is something like this, to check the visual field comparing with yours. If there's an abnormality, a perimetry is done or central field assessment, which is more detailed. Now, after that, fundoscopy is done and you assess your right eye to assess the patient's right eye. You check for red reflex and then you look at the retina. You do the same thing. You check for red reflex and then you look at the retina. So that concludes the optic, the olfactory and optic nerve. The next set of nerves are tested together. So those are 3, 4, 6. Now, what is important here is these nerves are the motor component, supply extraocular eye muscles. And the easy way to remember this is a formula called SO4, LR6, AR3, meaning the superior oblique muscle is supplied by the fourth cranial nerve, which is the trochlear nerve. The lateral rectus muscle is supplied by the sixth cranial nerve, which is the abducens nerve, and all the rest are supplied by the third cranial nerve, which is the oculomotor nerve, including the palpebra superioris muscle, levator palpebra superioris, which paralysis would lead to ptosis. Now, with that said, let's look at how. So what you want to do is you want to ask the patient to look up ahead. You want to take something like a pen, and then you want to ask them to follow the pen upward gaze, downward gaze, sideward gaze, inward gaze, like this, like that, and like that. Now, once you've done that testing, you want to assess for what is called convergence and pupillary constriction. So as you do these, the eyes are supposed to, move medially, bilaterally, and the pupils are supposed to constrict. So that's convergence. The next is you want to check for pupillary light reflex. And this is mediated sensory. This is mediated by the 2 and 3. So optic and oculomotor nerves. So you shine, so there's the direct and consensual. You shine light in the right eye, the right pupil constrict. You shine light in the left eye, the left pupil constrict. The consensual, you shine light in the left eye, the right pupil constrict. You flip that and do the same thing. You shine light in the right eye, the left pupil constrict. Now, once you've done that, the next thing to deal with is the trigeminal nerve. Again, it has sensory, motor as well. Now, the easiest way to learn this is to divide. So it's sensory component. You come to the angle of the eye and the angle of the mouth. And it has 3 branches. It has the ophthalmic, maxillary, and mandibular. So you test that using cotton wool bilaterally, like that, like that. That's for the sensory supply. Now, the next is you want to test the corneal reflex. So you ask the patient to look up, and if you touch the cornea, there's going to be a blink response. You touch the cornea, there's going to be a blink response. Usually, this is not routinely tested. Now, once you've done that, you want to test the motor component. So what you have is the trigeminal nerve supplies the muscles of mastication. So you want to ask the patient to clench, and you want to feel the temporalis. Then the masseter. Then the next is you want to ask the patient to open your mouth, the lateral and the lateral pterygoid. Then you ask them to move it from side to side. So open your mouth. So you've tested the pterygoids. This concludes that we've demonstrated how to test the olfactory, which is cranial nerve 1, optic, cranial nerve 2, oculomotor, trochlear, and abducens, which are tested together. That's cranial nerve 3, 4, and 6, and then the trigeminal nerve, which is cranial nerve 5. We're going to stop this now and then do the other. In part B, we'll do cranial nerve 7 to 12. So recap of this is going to require IPPA, wiper plus IPPA, but not all of the IPPA. Olfactory is tested with this the smell testing kit. Optic, you test using 3 things: visual acuity, visual field, and fundoscopy. Oculomotor, trochlear, and abducens nerve go together, and the motor, you test for motor, you test for convergence, and you test for light reflex. Trigeminal is sensory and motor, and that's tested like that, sensory. And then motor, you test by clenching and feeling for the muscles. And then you test also for the corneal reflex. Thank you for listening. Like and subscribe to the channel.